Hello there. Today's video, we're going to talk about Phentermine and Semaglutide together. Hi, I'm Dr. Carter with Modern Body Clinic, and we've helped countless people lose weight and live healthier lives. So if you're struggling to lose weight, you're not alone. By the time someone has seen me, they've tried countless things. They've tried vegan diet, they tried paleo, keto, they tried intermittent fasting, and nothing's working. I understand that could be quite frustrating. We try something different. We try an innovative approach. We look at medications as one of those routes. So in this video, we're going to talk about Phentermine and Semaglutide together. Now, you may or may not have heard of that before. It's not necessarily new. Real quick on how they work. So Phentermine is what we call a stimulant, and generally stimulants, what they do is they're going to decrease your appetite and also increase your metabolism. The way semaglutide works is similar in that it's going to decrease your appetite, but also is going to help control your blood sugar, so less of those sugars go stored as fat. And also is going to slow your GI tract down, and what that does is going to get less food to feel full, and also you'll feel full for longer. Obviously we want to be safe though. We want to use medications that are safe but effective. So when we are combining medications like these, yes, they are both FDA approved for weight loss, but they are not FDA approved to be used together for weight loss. That said, one of the things we want to look at though is how they are broken down so that we know that there's not going to be any drug interactions. So there's not a lot of studies on using these together. And just to give you a little bit of science, semaglutide is essentially broken down in the bloodstream, and most of it is excreted through the urine. And they have looked at safety in various degrees of kidney function, and so it seems to still be safe regardless of the kidney function. They also looked at liver function, and a lot of medications are metabolized through the liver, though very little of it passes through the liver with semaglutide. It's also true with Phentermine. Very little is actually getting broken down by the liver, and most of it is going through the urine. Knowing that, we can feel comfortable that they're not going to interact with each other. We can feel a level of safety with that. So let's focus on who should use this approach though. Pairing these two medications together, Phentermine and Semaglutide, are not for everybody. Generally, we're going to look at adding Phentermine to Semaglutide if the person is really not responding how we would anticipate. So they are getting some results, but not quite the level that we would anticipate. Or if it's someone that we feel has a lower metabolism, and so they don't have time to exercise, or they don't want to, they don't like it, whatever the reason may be, this is when we consider adding Phentermine as well. But what about those that should avoid it? In general, the people who should avoid it are going to be people who should not be on the medication. For semaglutide, that's going to be someone that has a history of medullary thyroid cancer, or MEN, which is a syndrome of cancers. If you have either one of those, you know it is rare, and so you would know that you have that. Other reasons that you should not be on semaglutide would be if you have severe gastroparesis, because it does slow your gut down, so you wouldn't want to be on it in that case. Or if you are breastfeeding or pregnant, you shouldn't be on it. If you have an allergic reaction, you should not be on it. The difference though is if you've had heart disease, particularly if it's recent, if you have uncontrolled high blood pressure, a recent stroke, then you should not be on Phentermine. Those are the people who should not be actually on either one of these medications. So that's it. If we pair these together, what is the expectation? Generally, it's going to be someone who is not doing ideally on one of these medications that we want to pair with. Semaglutide, we know about a 15% body weight is what to be expected for the majority of people. If you're on Phentermine, you can expect anywhere from 5 to 8%. Now, that doesn't mean when we add these medications together that they're going to add up to both benefits, meaning we should not expect 20 to 23% when we add these medications together. Generally, I would expect 10% body weight. Again, this is in people who are not responding as we would anticipate. That's the short and skinny of it. Semaglutide and Phentermine can be combined together off-label, so meaning not FDA approved. You want the provider to be comfortable prescribing that type of regimen. Works best if it's with diet or exercise program in place already, and you should be aware of potential side effects of those medications. So if you found this helpful, please subscribe. It helps the channel grow, and it will help you stay connected to more content like this. Otherwise, check out one of these videos on semaglutide and weight loss. See you next time.